And welcome to Compassionate Connections. This is our bi-weekly, bi-monthly, whatever it means to do it twice a month, time where we come on live and we have a group of people to talk about OCD and addiction. Now, just really quick, why is this topic important? Because so many people in our community are struggling with OCD and addiction. This has been kind of a historically ignored comorbidity in our community. And we really, I think once the pandemic hit, there were so many of us that were so passionate about this topic that we are like, we can't just sit by anymore and not acknowledge how prevalent this is in the community and how much we want to help normalize this experience for people. I'm just laughing at the comments in the private chat. I'm not laughing at you. But now I'm not going to look at them anymore because I hate Dr. McGrath. Anyway, so I first want to start off before I bring everyone one-on-one to introduce themselves. I want to remind you that at the end of this month, on May 29th, we have a virtual event called the OCD Gamechangers Retreat. Now, we are going to start pushing out a lot of information about this retreat in the next week or so. And we haven't because we've wanted community feedback first, so we can help design it based on the community needs. One topic including OCD and addiction. So please stay tuned to our Facebook and Instagram page so you can learn more about this retreat. Go to OCDGamechangers.com. Under the events tab to sign up. It's $50 for the whole day. It's about a 7-hour conference. Plus Friday night, we'll have a special guest and then hopefully a little event and something fun after that. So it's kind of like one day and then a little bit on Friday night just to get you all excited. If you are looking for a scholarship, please email us at ocdgamechangers@gmail.com. We have several scholarships available, and so we really want you to be there. Don't be afraid to email us and ask us. We really want you to get there and have the support. Okay, I'm going to bring everybody on one-on-one, and they're going to introduce themselves, who they are, and why this topic is important to them. Now, while you're listening and watching, get your questions ready because this session tonight is a Q&A with our panel. So please feel free to put your questions in the comment sections and there's two and one I hate right now. It's the private chat. But like the other comment section, please put your questions and we will address it. All right. First and foremost.
I knew it was going to be. I had a feeling you were going to pick me first this week.
Okay, Mr. Sean Shimmick.
Yeah, I'm not even going to say my name because Chrissy Hodge did it perfectly.
I know.
She's been saying it perfectly for so long now. It was a problem. Thank you for having me on. This is I'm an OCD advocate, mental warrior, hospital. But this is something that I struggled with, fought, and self-medicated life, and I didn't.
I think I'm experiencing some technical difficulties. Is everything good? Like you're in and out a little bit.
Oh, am I back?
Well, you're frozen. Oh, okay. Maybe now.
Am I back? Am I good?
Yes, you're. I think you're back.
Anyways, so
this
is part of my story as well. Self-medicating with alcohol. Feeling the only way I could connect was on the weekends after drinks and all that stuff like that, and to get away from a lot of my intrusive thoughts and a lot of the rituals that I was having. And I never really talked about it then, and I think that it's really important to talk about now. So I'm here to talk from a lived experience perspective. So if anybody has any questions that I can help with, bring them on.
Excellent. And you cleared all up, so we're all good.
Good.
All right. I'm going to try to structure this out so Patrick can be under the OCD Gamechangers logo. So who's next? We'll go with Lori. Hi, Lori.
Hi, everyone. I am cracking up back here. I am Lori Johnson. I have a group practice in the Denver, Colorado area in focused counseling. I am here tonight as an advocate, as a family member, as a clinician, and also as a support person with a lived experience. So I just hope to, bring all facets of that experience into any topics surrounding OCD and addiction. I have a huge passion for this. That really kind of spawned out of seeing a lot of untreated things in different community settings that I was working in. And then ding, one day the light bulb went off and I was like, I'm going to combine these two specialties. So that is what my practice and my team do. And I'm really happy to be here. This is a group of kick-ass people and have really great experiences. And hopefully some of this stuff resonates with all of you out there too.
Excellent. Thank you for being
Thanks for
here. And if
having me.
you're watching, please put your questions in the comment section. Tell us that you're here. We're going to address that. We've already got some questions that were emailed to us, but we want to add yours as well. All right, Dr. Dr. Patrick McGrath. Roll in the private chat.
What? I don't know what you're talking. I didn't.
Anyway, who are you?
Just some random dude who said, just clicked on something and showed up at this weird thing. So that's who I am. Patrick McGrath, yeah, clinical psychologist. I guess my claim to fame in this world is I opened up the Foglia Family Foundation Residential Treatment Center, which is the first residential treatment center in the world that would take on people who had dual diagnoses of OCD and substance use. Because prior to that, unfortunately, you'd get kicked out, and Margaret can speak to that, sadly, about what's happened in her family. But knowing Margaret, that really kind of inspired some ideas that I had and what we were looking at to open, and I was happy to kind of bring that into reality so that all the people who have OCD and who use substances as a way to deal with it no longer have to choose one or the other, but can get help for both at the same time.
Excellent. Thank you. And with that said, we'll bring Margaret on. Hi, Margaret. Yay.
Hi. Hey. Yes, Patrick.
Tell us about you.
Ditto. I'm Margaret Sisson, director and founder of Riley's Wish Foundation, and named it after my son, Riley, who struggled with OCD and addiction. And as Patrick was saying, couldn't get the help he needed, and unfortunately died of an accidental overdose. So I am passionate about helping others not be where we were, and whether that be families or individuals.
Yay! Margaret notoriously drops out of the stream every once in a while, but she always comes back. So for all of you out there with OCD, if you think, I just said something and pissed Margaret off, and she's like, I'm going to give you some reassurance.
I live in the country, so I'll just have to hang with me.
If the horses stop moving, the electricity dies in her house, and then she drops off the so she's kind of on this big treadmill. They just keep going and going. When the wind dies, it's the only way they get electricity out there.
That's right. That's right.
Get on, horsey, come on.
All right. So the next person in our chat is Mr. John Tessitore. Yay! Founder of JCK Foundation. Who are you?
This all the time. I'm just kind of sitting here cracking up, watching everyone jump on, and in the back, the chat is killing me right now. I'm not gonna lie. I'm John.
Oh, no, me too.
I'm John. I am the founder of the JCK Foundation, and we do a lot of work in high schools, middle schools, especially in terms of just community and connection with our programs in high schools, and really just trying to get students and faculty members and parents too to kind of be on the same page and be on the same wavelength and have really productive conversations without judgment and without shame. But with that being said, OCD is something, those three words have really plagued my life since I was 11 years old. And addiction has plagued my life since I was about 25 years old, and I'm 31 now. And I just want to provide any sort of insight, any sort of hope, just anything that could get someone through their day today. And if you're happy, I hope we can make you happier. And if you're struggling, I hope we can give you little bit of hope today, because there's a lot of great people on this chat that care about you. So yeah, thanks for being here. And I love a little StreamYard duck too. I was about to type that in the chat. That's my favorite thing, the StreamYard duck, the logo, but that's a different story. But anyway, thanks for having me, and it's an honor to be here as always.
Yeah, thank you for being here. And we are waiting on Lauren. She was running late with work. So as soon as she comes on, we'll bring her on and have her introduce herself to everybody. But this session in particular is a Q&A. So if you have questions, please drop them in the comment section if you are here live. I just want to get started with the first question, which would be, talk a little about, a lot of people hear about the term harm reduction. So talk about what harm reduction is or how it applies to your life. And we're just gonna, I guess maybe I should tell people that I have an interest in this because I also struggle with substance use. And I actually practice harm reduction when I'm experiencing addiction symptoms. The hardest part for me is the choice to practice it. I think I said this last time we all met. It's the choice, the same way it's hard to choose to do ERP. Even though I know ERP makes me feel better, I sometimes, I'm going to say it, I sometimes feel more comfortable in the chaos, which is why it's really hard to choose it sometimes. And I can elaborate on that, but I'd rather open it up for y'all first. So let's talk about harm reduction.
I see harm reduction from so many different facets. Being a person and a clinician, teaching people about mindfulness and acceptance and kind of practicing being present in the moment. Sometimes harm reduction could be a practice of mindfulness. So before I talk about that, I'm going to talk about it in the general kind of terms of reducing the harm that you have against yourself. That could be through alcohol, that could be through, reducing drug use, or, for needle users, recycling them and using clean needles. There's all different elements that can be processed. And just as a caveat, as a practitioner, like harm reduction is not available and not an option for all, because it can be really dangerous or fatal for someone to cease drinking or even reduce drinking of alcohol, producing withdrawal symptoms. So that's one facet of it, generically trying to reduce harm or reduce something overall. And that can be done slowly, that can be tapered down with the help of a professional. But I also see it kind of in this deeper facet, is that often when there's drinking or drugging or escape or just coping with substances or alcohol, mindfulness can help enjoy that experience. So let's say that someone is a drinker. Can you have 2 really wonderfully amazing fancy cocktails instead of 5 just pounding them down? So slowing down the process a little bit with an element of mindfulness, which is sensory, right? A crafted cocktail has so much more time that's put into it than just mixing a mixer and an alcohol, or having a craft beer versus, 5 Coors Lights. There's all kinds of different ways that people can do this. And there's actually a really wonderful book written about mindful drinking from the female perspective. It's called Mindful Drinking. And I just think that that's one of the components that I look at, is that it's not just the reduction of something, but it can also be about the mindfulness in the process. And I also use this with eating disorders too, because sometimes the overeating element can just be about the sensation, cessation, and flavor of the food versus the avoidance or the overconsumption. That's the most generic way that I can explain it. So those are my 2 perspectives.
Really quickly, before we continue, I want to add Lauren to the thread because she's here.
Hi,
Lauren.
I'm so sorry I'm running late, you guys. Thanks for having me on anyway.
You're fine. We're just on the first question anyway. If you want to just quickly introduce yourself, and then if you want to add to it, the question is, we're trying, what is harm reduction?
Okay. So my name is Lauren McMeekin. I am a licensed psychotherapist, and I work with OCD and eating disorders and anxiety disorders. And I work at the OCD Center of Los Angeles. And I think that sums me up in a general way. And in terms of harm reduction, yeah, I'm gonna pass for a moment and settle, if that's okay. If we can come back to me, that would be awesome.
Screw you, Lauren. That's all I have to say right now.
I totally wanted you to push Patrick into the logo.
Me and this logo are constantly in a battle. And once Lauren joined, I'm back. I'm just going to sit under the logo for the rest of the night. I'm just going to sit like this for the rest of tonight. You will not see the top of my face at all.
Well, I think that's a shame, Patrick.
Yeah, well, you made it happen, Lauren, so it's all
I
your
did.
fault. So.
I'm the worst. It's true.
Oh.
Well, if no one else is going to go, I can talk a little bit.
Go ahead.
About
Yeah,
just harm reduction in general. I think when I found out about this alternative to just you are an alcoholic or you're sober, boom, there's your two black and white issues. And I remember thinking, I can't fit into these boxes. The shame doesn't want me to fit in the alcoholic box. I'm just being honest. And just knowing how powerful it was over me at times, and knowing like that I struggle with it, didn't allow me to fix or fit in the sober 100% box. And so when I was introduced to harm reduction, it felt a lot like when I was introduced to ERP, which was, you don't have to, it was either the thoughts are real with the ERP or with OCD, or they're really real, or it's just OCD. And I couldn't believe either of them, right? The two extremes didn't make sense to me. There had to be some sort of middle ground. And so when I was introduced to harm reduction, I had to learn about what it means, learn about what in understanding the reducing harm. That's all I needed to know, because some days I can reduce harm greatly. Other days I can only do it in small little increments, but it still gives me control and power. It still helps me feel control and power, because the substance use makes me feel 100% powerless. So if I could just push back even a little bit, okay, I know I'm going to drink wine tonight, but I'm going to wait until 6:30, right? If I can wait, I feel power. And actually having kind of that agency helps me to then be like, wait a minute, I can actually make even smarter decisions the rest of the night. And so, smarter for me, I'm certainly not saying that in a shame way, but instead of having 8 glasses of wine, because I started at 6:30 and I was able to do it, wow, I'm not going to have another glass until 8:30. And it makes me believe I'm capable of doing it. Instead of, you just can't drink wine or else. That just didn't work for my brain. So recently, just really quickly, I've recognized that I've been having some addiction to social media. And when that hit me, it was very shameful. I had a lot of shame, and I also had withdrawal symptoms. When I put harm reduction boundaries in it, it was horrible, and I was mortified at myself, but whatever. I think a lot of people are dealing with this now, and they don't even know it. The harm reduction strategies I put in are, I can look at social media until this point in the morning, and then I don't look at it until after this time at night. It has absolutely changed my life. It has absolutely changed my relationship with my family, my personal life, my ability to feel like whether I'm distracted or not, So harm reduction works. It's just, I think, understanding, and you can work with a therapist on this. It's understanding what that means for you. What harm do you need to reduce in your life in order for it to fit and really make it effective?
Lauren, you had your hand up. Yeah.
I did. Why did I raise my hand and not just unmute myself and say like, hey, I think I have something to say. So I just thank you for what you just shared, Christy. And I think sort of following up with regard to harm reduction, one of the things I've been reading a lot about recently are the policies that were implemented in Switzerland in the 1990s because of the HIV/AIDS crisis. There were a lot of people who were using heroin, and a lot of like a heightened infection at the time, infection rate. And their solution to that was to legalize heroin. And I think that when we don't look at all the options and some of these, you know, on its face, a more extreme idea, that we miss out on some really helpful ways of approaching substance abuse. And what they've certainly had less deaths as a result of drug use, specifically heroin use since then. And a lot of people have found their way to a more productive life. And I think it's important that, you know, in this discussion, that it not be black and white, that it not be, you know, all or none. Yeah, I think.
Yeah, I think there's another side. And go ahead, Lauren. Sorry.
We tend to do this, Patrick. We do this together all the time.
We're simpatico, so we do that.
You go ahead. I already spoke. I was just adding on what Lauren said, and there's also some comments about that black and white stuff. So please go.
Yeah, I think too that it depends on country-wise too how you look at this. Certain countries throw you in jail, and you're just in jail and being punished for things, and then other countries, if you are arrested, actually do rehab and do help you be able to become a functioning person in society as well too. And it would be nice if we took a look at some of the models of, say, Danish prisons and the way that they handle some of these experiences that people go through, because their goal really is to rehab people and to get them back into society and not just punish people. And I'd like to, I hope we see something like that happen at some point.
Yeah, and just to follow up, because I think the Swiss model incorporates some of those tenets of recovery. It's not quite the same, but the idea being that you're using in a safe room with supervision, and you are offered different resources to find your way towards something that's meaningful for you. And ultimately, finding meaning and finding purpose is such an important piece of the puzzle.
Lori, did you want to add something before we move on to the next question?
Yeah, I think I probably would readjust what I said in the beginning, and I would start out with the fact that harm reduction is not acceptable to all. In fact, the times in which, you know, Chrissy and Margaret and Patrick and I and some other colleagues have spoken about this in public, we get a lot of kickback that we're trying to engage or encourage people to continue drinking or drugging. And that's not the idea here. Yeah. There is a recovery journey for each and every person in each and every substance. And there are so many ways in order to begin that journey. And for some people, you know, mindful drinking or harm reduction has been the path to be like, oh my gosh, I'm not in this black or white or this all or nothing, that there is some room for me here to make improvements. And so we're not encouraging people to continue, using or drinking or to start using or drinking. We're just saying that there's another path that is often not talked about because it is not for everyone. But it is a really great launch pad for some to decide to take the next step in their recovery, whether that's going to treatment, getting a higher level of care, finally getting into a therapist, talking to their family. These are launch pads for discussion and conversation around the shame and guilt with substance use and alcohol use disorders.
Well, and to piggyback on that, I think when you're challenging the status quo of what is projected into also media wise, when we typically think of addicts and people that struggle with substance use as good or bad, right? And so it's very much this, well, you're good if you get sober. You're good if you're bad if you continue, you're bad if this. And that's just, it's not a healthy and it's not a trauma informed way of looking at this stuff. There has to be some sort of medium, or median. And I think that's, Lori, why, I'm not just talking to you, but I'm just responding to your comment. I think that's why.
Preaching to the choir.
When someone posts something, I've been noticing on social media, especially in the last year and a half, as I've been focusing, and it's on my radar for addiction, when people post about harm reduction or they post about other paths other than just sobriety, you will get people in the comments like, nope, the big book is the only way, or whatever it is, the blue book or the
it's a big book.
Big book.
It is
The
blue.
big book.
Okay, the book, that's the only way. And I mean, frankly, there's not a lot of evidence behind the big book,
I'll be
for
honest,
long term.
that becomes intimidating too. If you think there's only one way to do something, I mean, when has that ever worked out in anything in life, right? If there's one way to do something, then we're all going to end up in some trouble, So I think that's a really interesting point that you all bring up about harm reduction and also just about this in general, is I just feel like it's so important that, we don't put someone in a box and say, hey, this is how you have to do this. And if that's how you like to do it and it's working for you, then we want you to keep doing it. Keep doing what works, but keep trying different things. Keep having hope. Keep mixing things around to do what works for you in life in general too. Because I just noticed that when you usually say, a lot of people, and I'll tell you straight up from my experience with addiction, it took me 4 years to really get it and really want to stop, because I was almost so intimidated by, I have to do this. And, for me, when people tell me I have to do something, I usually kind of panic, and I don't want to have to do something. I don't know if that's just kind of a John Tessitore issue or not, but still, it's just it made things a little bit harder. And then, when people said, hey, this could help, John, do this, then you start doing it, then you start feeling a little bit more comfortable listening and taking the advice of someone else and trying some different techniques and getting, in my opinion, just a little bit healthier, so to speak. So I just feel like it's, anytime you put anything into a box, you get, especially with OCD and with addiction, it becomes very intimidating, because, with my OCD in mind, I say, well, if I do this, it's going to change my personality. If my personality is changed, am I going to be able to do my work? And if I can't do my work, am I going to be able to be the person that people like? And if I'm not the person people like, who am I? So it just goes on and on and on. So I think that's just kind of ramble a little bit, but I guess that's my 2 cents there.
Well, and I think too, for all of us, we all have our different ways of treating it. If you come to Foglia, we're going to talk about sobriety. I mean, that is what we're going to do, and that's how we're going to approach it there. We're not going to talk about harm reduction. But, I've met people at Foglia who've said, well, I'm on my 27th detox. Well, harm reduction hasn't really worked so well in that kind of case, right? So, it's just, I think we've proven our point here already. Let's look at a different route. So, all of us have a different journey. And even for people here on this panel who have family members or themselves who have used substances, have different ways that they've approached it as well too. So, it's good to have a discussion like this and to be able to be open and talk about it and not be throwing slurs and hatred at each other, which sometimes happens. I want people to live the best life that they can. And, when they're with me at Foglia, that they're at that level of residential, that sobriety at that point is, that's kind of what seems to be needed. So, and Margaret, I think that, you could talk about that too, from your own personal experience with Riley and everything as well.
Yeah. As I listen, Riley harm reduction would not have worked for Riley. And he would say when he was in recovery, he would talk about, well, I'd say, yeah, I'm going to have one today. And then the next day I'd have 50. And then it went out of control. And as Patrick and I discussed, when doctors would put him on Klonopin to ease his anxiety, well, that would set his cravings, his addiction cravings. And then there he went. And that was, and his brain would just crave anything. And so for Riley, his recovery had to be absence. He could not. And that was hard because he never got, he had the OCD and that wasn't treated. So it was just this vicious cycle. And people watching this, if that's what's happening to you, let's call Patrick, let's get you help that, so you can conquer this. It's difficult. And if you need help and support, and all these people on here will give you help and support. Because if you're in that, just like Patrick said, if you're at Fogley, you probably need to be, no harm reduction. You probably need to be for that period of time.
Mm-hmm. Mm-hmm.
And then I know others that have been at Fogley and they were absent from, so they did not, because you can't drink or do anything while you're in treatment.
No, we don't have a bar there, so no. No.
But they learned about all the parts and learned about themselves and what they can do. And they were able to go back into life in a better way where they understood. And then others have been able to do harm reduction. Mm-hmm. And they knew what their limits were. They knew, because they addressed so much with their OCD and their anxiety and trauma, et cetera, et cetera. So I think it all depends on the person.
I think this is a good segue actually into another question. How can I deal with OCD without using something to numb it? I think this is a great, as soon as Margaret, you started talking about this, I was like, ooh, this is perfect, because that is the issue we're dealing with here, usually, right? I mean, we also, addiction can be caused by trauma, but we also know that OCD can be traumatic, or the experience of it in different facets. But this is where people get caught. And when you're dealing with OCD for a decade or more without even knowing it's OCD, you're having pedophile intrusive thoughts for 12 years and you don't even know what it is. And you're like, oh, but if I drink, I can sleep and I don't have to think that I'm a monster. Okay. So then, then it's this, we want to get treatment for OCD, but we need to pull this addiction away first. And you were like, no, I want to hold on to that because it's the only thing that saved me for 12 years. That's the crux, isn't it? That's the place. I know it was for me and for a lot of people. So I'll let other people talk before I get all fired up and all red.
Once you've learned how to calm down the OCD brain, you're going to go for it, right? So, Margaret, we talked about Riley's, what he said about drinking when he was a teenager, what it finally did for something that not even any other compulsion he'd ever done. And other people who figure out this compulsion, and even if it gives you that millisecond of relief, the joy that millisecond of relief brings to your life is worth going through all of the things that you need to do in order to get that relief again. And I would say this from a therapist point of view, my job is to teach people that there is another way to get relief, but it's counterintuitive, right? I mean, if OCD's goal of relief is do whatever you can to make this go away, and my goal with ERP is I'm going to give you relief, but you're going to have to walk through all the shit to get there. Now you've got two choices, right? Do you go through it and learn that you can handle it, or do you keep doing this thing to try to dodge it, right? And that's probably one of the hardest decisions that anyone will ever make in their life, is to decide to walk away from the dodge and to go through the fire and hopefully see that on the other side there's potentially relief that can be had, right? And hopefully I, as a clinician, can convince somebody to do that. You know, one of my favorite phrases in the world, and I don't remember if I've said it on here, but one of my favorite phrases in the world is, only an Irishman can tell you to go to hell and make you look forward to the journey. And that's how I look at therapy, right? I'm going to ask you to go through hell and get you excited about it and recognize that on the other side, it's not actually so bad. And when you do that, you can be better. But you're going to have to abandon every one of these things that works for you, parentheses, for a little while, close parentheses.
On both ends, with the OCD and with whatever is coming because of the drinking or drugging. Which is a lot of emotions. I don't know about any of you, but I didn't really learn about a lot of emotions or how to handle tough stuff until I went to graduate school to become a therapist.
I didn't really learn how to handle tough emotions until I stopped gambling, to be honest.
That was your distraction. Yeah.
Mm-hmm.
Yeah. That was your distraction. That was your thing, right?
Yeah.
And then someone like Sean, who's taken that and modified it into something productive, like drawing and everything, right, Sean? Where now you can take that experience that you likely tried to dodge for so long, and now you can channel it into something amazingly beautiful and productive and utilize it, and you're not afraid of it anymore like you used to be.
No, yeah, thanks for saying that. And I was going to kind of piggyback of what you were saying, and Lori and John, and a lot of what helped me move forward in a lot of ways in terms of not wanting to numb my emotions was actually accepting that they were there and they weren't as dangerous as I thought they were, or the stories that they weren't telling me, or the stories that they were telling me were actually bullshit OCD stories rather than what they were in reality, and giving me information. So after my residential program at a program about 5 years ago, I decided for this reason to go completely sober for 4 years, cold turkey. No big book, nothing. Just, it was a decision that I made that I wanted to extend my therapy that I was doing with ERP in residential program and acceptance and commitment therapy, and take that forward into my life so that I didn't feel like I needed to numb, and I could feel the emotions that I wanted to feel, good, bad, indifferent, everything in between. And I'd gotten to a point with my OCD recovery that I was able to, it wasn't so in my head all the time, where I was actually able to feel the emotions, even anger and sadness, and not attribute it to some sort of intrusive thought, like I was, a psychopath, or if I was angry, I was going to hurt someone, stuff like that. So that was a big thing for me. And the artwork part really took off kind of from that root, where I wanted other people, and I want, frankly, myself, to continue to force ourselves to see and accept the feelings of anxiety, accept the feelings of anger, accept the feelings of sadness or whatever, along with the feelings of love and joy and contentment and whatever else. Whenever I numbed out, I was numbing out kind of everything, and I wanted to learn how to, like, this sounds maybe funny, but the only way I could ever go out and have fun and dance was like I needed to have some drinks, and I wanted to be able to go out there and push myself and dance and have a good time. And the only way that I was going to do that was go out there and dance and have a good time without any kind of help or numbing agent, and just do it and practice it. And it worked. Some of the greatest times I had actually were that time where I was able to just let go and be me authentically and freaking dance, or guide someone in a workshop about putting something that's scary in front of them, and having them accept that and visualize it and see it, and not stow it away in a place of denial or avoidance to help with that numbness. So all that stuff really helped me in my journey. So thanks for bringing that up, Dr. McGrath. Appreciate it.
Absolutely. Absolutely. Mm-hmm.
I really love what everyone has said. So, John, where are you going to go? You go. Okay. I was just going to say, I've loved what everyone said so far. And just to sort of continue with, with the discussion, I think really it's the way to deal with OCD without using something to numb it is to learn how to just be with the feelings and learn how to befriend the feelings, right? Instead of, I think part of the problem is that with both OCD and substance use disorder, we find ourselves just in this cycle of avoid pain, get pleasure, avoid pain, get pleasure. And that there is something more, but I don't think most people are taught about it unless they go to treatment or go to therapy, which is that you can learn how to make space for all of your emotions. You can learn how to be with them and to be less bothered by them, essentially. And in doing so, that leads to greater comfort with emotions like anxiety that have historically, the only way around it was to numb them. So I guess I'm probably just echoing what everyone has said so far, but.
Yeah. Go ahead, Chrissy. You have something to say.
Well, I just wanted to echo something along the lines of what John said earlier about that, we have to always remember that people's experience with mental health or addiction or whatever else we're dealing with is not just this clean-cut path where we're walking along and there's no leaves on the trail. So when we live with OCD, we are essentially living with a brain that is telling us day in and day out I wrote this down. I put something along the lines of putting people in a box. So when you have OCD, you're told what you can and can't do, what you shouldn't do, what you shouldn't think, what you can and can't think all day, every day, all day, every day, all day, every day, right? So there we are. How many people have lived with that for decades who didn't know what was going on, didn't know how to escape, didn't know how to tell anybody, and boom, here comes alcohol or gambling or sex or whatever else. Okay? Not to mention all of our childhood trauma we may have dealt with, other things, tragedies, things that have happened in our life. And then when we get to a place where we finally find out it was OCD, I can't speak for everybody, but that was 12 years for me, not to mention things that had happened in my young adult life. And then the only way I knew was to experiment with substance use. It was the only thing that actually calmed things down, even after treatment. And I want to make that distinction. Even after treatment, it was the way I dealt with trauma. And so when years and years and years later, I think it's really important to remember that we all have to consider as we age, as we, as we find out there are different and other options and solutions, we get the opportunity to be able to explore what works for us.
Mhm.
We do that in OCD too. Yes, we know that ERP is the gold standard, but does ERP help? And then all of a sudden, maybe we need like trauma therapy, or we need DBT, or we need other things on top of that other than the behavioral therapy. That's okay too, right? So I think it's really important for all of us when we're talking about these really sensitive topics to remember that it's okay what your journey is, and it's okay what helps you, but it's really not okay to say that because I went down that path, you should too, or else.
I can explain just my angle as a therapist. And one of the reasons I take the sobriety model, and I'll own that I do, is I wouldn't tell someone with OCD after OCD treatment that it's okay now to go back to doing some compulsions, right? So similarly, I take the same way with substance use. Now that's me, okay? And hey, I own that's how I approach it, and that's my viewpoint and how I look at it. At the same point, though, I think what Chrissy have said and John have said, that if someone's not willing to do that, then I'm more than happy if you're willing to at least be open to decreasing. Okay. So I will always approach it that way personally, as the way that I do treatment. I'd like to get you to stop, but if I can't get you to stop, can I get you to slow down? And that's how I will look at it. But I'd be open to other thoughts on that, but that's what I like.
Yeah. Well, there's also a part of harm reduction that we're not talking about that is part of medication-assisted treatments for addiction, such as abuse for alcohol, acamprosate, naltrexone, naloxone, any other. Feel free to kind of throw them all out there. But these are also life-saving drugs that help people not relapse, that do help people reduce cravings and drinking and other things, and help them reduce harm in their life. So it's not just, stop doing this, or maybe just reduce the amount that you're drinking. The whole goal is sobriety in the end, if that's possible for a person. So the different paths that we use to get there, and the different medication and pharmaceuticals that can be used to help someone do that, are also harm reduction techniques, and are really, for many people, really productive and useful medications that help with that.
Yeah, those are super important.
We forget about those because they're a prescription.
Yeah.
Right? We started out talking about self-harm reduction, and then there is this whole medical model. As someone made a comment in the section, that this is a disease.
Mm-hmm.
Yeah.
And just like management of any disease, every single person on that continuum is in a completely different space. And, part of the recovery journey is also relapse, and kind of planning around that too, is that there are many people out there who are managing their diabetes who still overindulge on sugar and really push their insulin down or up in any kind of way that is harmful to them. And there are people who are on the dot, taking their medication, testing their sugar levels. Just as with this, it looks so different across the board. And the emotional journey with that is different too.
I think what's so important, though, is just how go ahead, Margaret.
I listen to this. It is so individual on what you do, and how you. And I look at it when alcohol or drugs or whatever it starts to harm your life, your relationships, your job, your et cetera, and you can't function. And if it's that's where it's hard to say, well, harm reduction, I don't know. It's all individually how you treat it. And I use the example of Riley because when he was in recovery, he would say, when I drink, I can't stop. And when he was in active addiction, he would come up with every excuse and lie why Klonopin was good. But when he was in recovery, he would admit that that's what would send him into cravings. So it's so individual with every person. And Lauren and I've taught, and Patrick, if AA works for you, or smart recovery, or if harm reduction works in your life and keeps you in a good place with your relationships, your job, your whatever you do, then that's okay. And there's no shame to that you have to be. And I think it depends on you. And Chrissy, we've talked about this. Riley couldn't. He couldn't do that. And you can, when you practice harm reduction, you can. And you know how to, you're different. Your brain is different than Riley's was. Riley couldn't do that. So I think it is so dependent on the person. So.
Yeah. And the
I
point
totally-
is too.
oh,
Yeah,
sorry.
go ahead, Lauren.
No, John, you go.
And one thing less I'll say real quick is just the point is, right, when we're talking about this, it's like we're all on the same team. You know, we're all trying to figure out a way to make our lives better, our lives more healthy. You know, when if you tell someone to do something specifically and they do something a little differently, like that's what I love about this. Like I'll take something from what Chrissy says, something from what Margaret says, something from what Patrick says, and I'll infuse that, something from what Lori, Sean, what Lauren said, and I'll infuse that in my own life, in my own recovery. And I think that's the key, is when we can kind of listen without judgment and say, okay, well, that's a really good point that Chrissy makes. And even if you don't fully agree with it, or if that's a really good point that Patrick makes, if you don't fully agree with it, take that with you and say, dang, like that's a great perspective. Let me take something from that. Let me respect it and try to, you know, build on it. I think that's one of the biggest things that I see intimidates people and gets people so upset, is when, at least for me, I would hate when people would just like, I would always be like, listen, like, I might not be right, but even if I'm wrong, I'm not against you, man. Like, I'm trying to help you out here. So I think that's something that's really important. And Margaret, you hit the nail on the head, right? It's I think that's such a vital way to approach this, and a vital way to approach, you know, each other, and kind of having that's what we're doing, compassionate connections here, right? And that's the whole point of this, is to compassionately, you know, be there for someone and help them with whatever they're going through. But sorry, Lauren, you go ahead.
No. Yeah, I think there's a saying that's often used in 12-step, that's take what you like and leave the rest, which kind of echoes what you were just saying, John, right? And I think that's true, right? Like, everyone is individual, and there's no one size fits all to treatment. And especially given that when we look at like the stages of change, that some people aren't in the stage where they're willing to go to sobriety. Perhaps that would be best for them if we could objectively measure that. But if they're not willing, then, to what Patrick said, something is better than nothing. And
Yes.
being able to talk about what's going on openly and be heard can be very healing, and actually can help people to make the choice that, you know what, I do want to try sobriety. I do want to do this. And people believe in me. People care about me. I think that, unfortunately, when we look at it as this is the only way, then people start to feel that they're basically not included, and that they have nowhere to talk. And then there's not any movement. There's just sort of this standstill. And like a personal perspective, right? I've been sober since 2005, and that's what worked for me. And I'm really grateful to 12-step and to the Big Book. That doesn't mean that somebody else might not have a totally different path.
Mm-hmm. Just to echo on that, I do peer support for a living. I know that's very different from therapy, but one of the foundations of doing peer support is you don't coerce people into therapy. You don't coerce people into doing things that they don't want to do, because coercion doesn't work. You know what does work? Empowering people, helping people understand why they have behaviors, helping people understand why they're experiencing things. And that's what we do, is we help empower people on their own journey of recovery for OCD and addiction. Coercion is a dead end. It's a, you know, it may work for some people. I don't know, but I don't know many people. And I worked in the state institution and coercion was always a way for people to lash out and say, I want to do the exact opposite because I don't want to be told what to do. As an adult who's living with a stigmatized disorder, and maybe even more than that if you're struggling with addiction. So it's really important to understand how to talk to people who are struggling with addiction, how to talk to them in a way that is not putting them in a box and shaming them into making decisions, but more, hey, how can I support this? How can we talk about this openly? Understanding they may tell you, when you say this, it makes me feel this way. It makes me want to go drink when you say this to me. Okay, well then that's your responsibility if you're a support person. Don't say that anymore. Like, learn how to support the person, because people who struggle with addiction and substance use, which you're looking at one right now, a lot of times feel very shamed and powerless. So I choose to talk to people who empower me and who don't talk to me with shame and actually give me a choice. Instead of feeling like I have to run to something because I'm talking to someone who's shaming me.
Well, it's a debate that will continue to, well, I don't know, debate's the wrong word. It's a discussion that should continue to go on. It doesn't have to be a debate, right?
It can't be, can it?
Yeah. I don't think it gets anywhere when it is. And we've seen that happen before. So
Yeah.
it's nice to see people from all sides of this can be here and be civil and discuss and support. And that's what I appreciate. So thanks for that.
So any
Yeah, for sure.
really quick final thoughts? We're a little after 7, so I just want to make sure and to respect everybody's time. Should we just go around just some final thoughts tonight? Lauren, do you want to start?
Sure. Yeah, I don't know that I have a ton to say other than I do really appreciate the ability to have these conversations and to discuss. Because I think that that's how we grow and we develop new ways, right? Ways that are more inclusive, maybe ways that support people who might not otherwise be supported. So I think that this is an important thing that needs to be done more often, frankly.
What about you, Margaret? Margaret, you stayed with us almost the whole time. This is a record.
I know. I try not to even move. So, and I'm going to piggyback on Lauren's comments. I think how important that we're here talking about this and not being judgmental, and not, because at the end of the day, we just want whoever is struggling, or whether it's one of us, at the end of the day, we want to be peaceful and have relationships and live a life that's a nice life. So however we do that, and we're not going to judge whether you do harm reduction or you got to be sober. It's just this discussion that, because maybe that one person that thought, I can't be sober, I can't do this, but to listen to all this and with no judgment, say, maybe I can, I'm going to try, or I'm going to reach out. And God, that's what it's all about. Because at the end of the day, it's saving lives, and it's having people that have a productive, happy life. So that's my take.
What about you, Patrick? Now that you're not under the logo anymore.
Yeah. Take that, Lori.
In the face.
In the face. Right, literally in the face. Yeah. So my view in treatment for all these years has been the elimination of safety-seeking behaviors. And when drugs or alcohol become a safety-seeking behavior, I look at them just like compulsions, and my goal is to eliminate them. It is how I approach treatment and will continue to do so. I have seen very good results with it. And but I'm going to hold fast to what I said. If someone isn't willing to do that, maybe some kind of harm reduction is a step in the direction. I've seen that even in OCD, where people have said, I've gone enough in therapy right now. I'm not willing yet to give up these compulsions. And then 6 months later, they come back and they say, okay, now I'm ready. Sometimes people need those steps to get to it as well, too. So I'm always going to push for the elimination of safety behaviors. It's in my core of how I do therapy with people. But I know that everybody's journey to that point sometimes has some stops and starts. And if that's what it has to be to get there, then I'll be on that journey with you, however we need to take it.
Thank you. Lori, what about you?
I'm going to piggyback on what you said, Patrick. It is about that journey to get there. And I think educating yourself as well, right? It's not just because these people said this on this one live Facebook evening. There's harmrecovery.org. Educate yourself, understand what those mean. Look at the recovery resources, whether it's AA, Smart Recovery, Recovery Dharma. There's a lot of them out there, and also books and other people who can be a mentorship. And part of this process and talking about addiction is so that people can get back to worthwhile living, solid relationships, and a sense of well-being within themselves. So anything that you've taken away from our conversation today is that there are multiple paths, and this is one of those that we've talked about. And I'm honored because I remember talking with Chrissy on your YouTube channel, and we talked about harm reduction, and from then something clicked for you. So I've been a part of that journey, on a personal stance too, and that was, just really inspiring. And now you bring that to the community. So thank you all for all of you who have attended. And if you're sober, great. If you're harm reduction, great. If you just tuned in for the first time, take away some hope that we're all here together sharing this information for you.
Sean, what do you think?
Yeah, I'm in the easy spot here where I can say that literally everything that everybody just said is what I was about to say. All these is exactly. So I literally echo everything that everybody just said, but really what the takeaway for me and what I want to reiterate is the fact that I think talking about different ideas is important, and getting them out there, getting that, whether you agree with it or not wholeheartedly or whatever. I think it's important to have these discussions, different perspectives. It gives you a chance to maybe put yourself in someone else's shoes, even just for a little bit, by listening to them talk, and maybe opening yourself up to something different. Because like it's been said a million times in this podcast just right now, we all have different journeys that are just different in many different ways. And mine has been different than Lauren's, and what Riley went through, and what Dr. McGrath sees, and what Lori sees, and what Chrissy's been through. And so it's good to have these discussions out in the open, and for us to listen as compassionately as we can. And this is what helps build connection in the community. So thanks, Chrissy, for having me and everybody else here. And thanks for everybody for listening. So
my comment, the loudest train that has ever come by my house is just decided to come through right now. So if it's horrible, it was so loud a minute ago. I was like, Sean, keep talking, please keep talking. I just wanted to end with thank you to everybody. Thank you to everybody who's listened. As we do these chats, I just think of all the things we can dig into, all of the, the pockets of shame and guilt and pain that people experience. I want to open up so people know they can talk about it openly. That is the most important part. Addiction, substance use, it gets so buried in the black and white. If you drink this much, you're a loser. If you don't, you're a winner. It does get that. And I think you don't often see a group like this just talking openly and being able to express things that even if we do disagree or agree or whatever, we're still meeting each other where we're at. Because isn't that what healing is about? Meeting each other where we're at. So thank you all for showing up and meeting me. And I hope I can always show up and meet you. And I hope that you who are listening will continue to show up as we dig into some of these deep topics. The best thing that we can do when someone is struggling, no matter whether it's mental health or whether it's addiction or physical illness or anything, is just say, I'm here. I'm going to show up. I'm going to listen and not judge. And I think we've done that so far. And I hope to keep doing that. So thank you to everyone. If you have not already, please go to OCDGamechangers.com under the events tab and buy your ticket for the OCD Game Changers retreat. We will be here as a group. I don't know if all y'all knew that, but you're going to be. We're going to be in a couple of the cabins providing support, opening up some conversations, talking more about this. And we're going to have a ton of other topics, OCD and grief. We're going to have OCD and LGBTQ community, the OCD and chronic illness. So many really awesome topics. So check us out. Come and see us. I can't wait. And we'll see you in a couple weeks. Thank you for being here. Bye, everyone.
See ya. Bye.